Hi everybody, it's Susie again for my third video. Still pre-op. Today's Wednesday, September the 8th, and I'm having my surgery on Thursday the 16th, so I've got about a week to go. And today I had my pre-op visit with the surgeon, and then he gave me scripts to go on over to the hospital and do my pre-op, like pre-registration and pre-op interview with the nurse for history and have labs drawn and EKG and stuff like that. So first part is, I just thought I'd tell you a little bit about the day today, because it was a long day. I just got out of the shower and I am exhausted. Look at all the stuff I have. So when I went over to the surgeon's office, I had a couple questions written down for him, that I had thought of, and he gave me this little pamphlet about things that I can expect after surgery, pre and post-op. And it's pretty informative. It's about 5 pages long, actually. It gives out some pretty good information that I had been wondering about. So again, I'm having a lumbar fusion, a spinal fusion done at L5 and S1. They're going to do, and that's because I have ruptured discs from an accident at work. So they're going to end a laminectomy, which is where they take out the bone. So they're going to go in and take out the bad disc between L5 and S1, take the disc completely out, cut away some of the bone that might be pinching on nerves also. And then they put spacers in between the vertebrae, and the bone is going to grow into the spacers and fuse that area between the vertebrae so that it becomes one solid area. And it's about a 6-month recovery time for that bone to totally fuse. So a couple of the things that he says in this pamphlet, it just says before the operation the area is going to be shaved because hair is germy. It says I'm going to need to have an empty stomach the night before surgery, nothing to eat or drink after midnight. And you can just take your medication in the morning with just a sip of water. Day of surgery, sedative injection before surgery, yay, help you relax. And it says, he didn't tell me how long the surgery is going to be. I've heard it's about 5 hours, but they're going to call me the day before surgery to give me the surgery time, and I figured at that time I would find out how much time is blocked off for the operating room, and then I'll have an idea of how long the surgery is actually going to be. It says recovery room is going to be about 2 hours, and it says once I'm taken to my room the day of surgery, just very sleepy that day and spend the rest of the day sleeping. And it says it's a good idea to suggest that visitors wait a day or two before coming to see you. Probably a good idea. You will rest in bed for the day of surgery, but you will be allowed to use pillows to remain comfortable. You can roll side to side. It says the hospital stay is about 3 to 4 days, and initially bed rest the first couple of days after surgery. A back brace, which I showed you the last video, is already ordered, and it says you must wear the back brace when you're out of bed, and the nurses will teach you how to put it on and off, and assist in walking and physical therapy. And by the time you go home, you should be able to walk independently to and from the bathroom, and you should be able to get in and out of bed by yourself. You should also learn to put on and take off your back brace. It says the first couple days after surgery, probably just ice and fluids until, working my way up to solid food. Also a catheter for your bladder, and it says that catheter is taken out once you can get up and go to the bathroom. And maybe some breathing treatments to prevent lung congestion, especially if you're a heavy smoker, but I'm not a smoker, so that shouldn't be a problem. It says you can't shower for the first few days after surgery. He said that I won't have to wear my back brace in the shower, but it says here to be careful, you have to keep your back straight and not bend over. As soon as you're finished showering and drying off, you must put the brace back on. If you wish, a shower chair is available, and they already sent that to me, so that's here waiting. And this was interesting. My aunt had surgery with the same surgeon. She's doing really well, but she told me about this part too. It says you will have medication ordered for pain while you are in the hospital. This will be brought to you by the nurses if you ask. It is important for you to realize that you may still feel some of the pains in your back, buttocks, and legs that you had before surgery. When nerves get pinched and bruised by a ruptured disc or by arthritic spurs, it takes several weeks for the nerves to heal. Until they heal, you may still experience some of the pain and numbness as you did prior to surgery. Please be patient and do not become alarmed. So my aunt said that happened to her, that she was kind of nervous after surgery because she was still having some of that shooting nerve pain down her legs and some of the numbness and weakness, and that she had called this surgeon and he said, don't worry about it, it'll get better, and that it has gotten better. It says at home the best thing to do is to take it easy once you get home. Do not drive the car until you're instructed, which is usually 1 to 2 weeks, this says. And it says stay out of a motor vehicle completely, except as needed to get home and to the doctor's office. And the reason that they give here, it says if you're involved in an accident right after back surgery, it can cause a lot of damage and pain. Well, I guess so. The best exercise, this says, is walking. Have someone go with you until you're feeling strong. Walk on sidewalks or pavement. Uneven or grassy areas could cause you to fall. And it says walk as much as you can. No other exercise or work of any kind in the home or yard is to be done. Do not lift anything more than 5 to 10 pounds in weight. You may climb stairs if necessary with caution. And sexual relations are allowed carefully, it says, after surgery and when you feel able. I don't want to. A firm mattress, it says, is best, and it recommends that you place a 3/4 inch plywood between your mattress and box spring, or put the mattress on the floor. This says do not lie on the couch or sofa. Recliner chairs are not good immediately post-op. It says you're allowed to sit in these chairs, but we recommend you don't recline. Avoid lawn chairs as they've been known to collapse and cause injury. And it says you should not walk around for more than an hour at most without, you should not sit down for more than an hour without getting up to walk around. The incision should be washed with soap and water. No ointments are needed. Call the doctor if you're running a fever over 101. Well, I guess so. Or if your incision is draining anything, and the doctor will see you in the office in usually 1 to 3 weeks. So a lot of stuff here. It's very interesting. So then I left his office. I went over to the hospital, did pre-registration, went back and spoke to the pre-op nurse. And one thing I would recommend is that you have your medical history kind of written down. It would go a lot quicker. Have a list of your medications that you take, any medications that you're allergic to, your immunization history, vaccination history, and what was the other thing that I didn't have? Oh, surgeries. So surgeries, meds, allergies, and your vaccinations and immunizations. They ask about all that. And of course your whole health history. So then after I did that with the nurse, they drew blood. They did a CBC, CMP, PT, PTT, and type and cross for a couple units of blood to give. So basically all the blood work that you can imagine. They did an EKG. Then they had me meet with the nurse practitioner from anesthesia. And she went over the health history again. And I told her that my main concern with anesthesia is that in the past I've been really, really severely nauseated. So they said, don't worry, they'll pre-medicate me and it should go better. And also they're going to give me a little something beforehand to take the edge off. So that was a big day. I'm really sore riding home, really exhausted, and really excited. So I hope this video helps a little bit, and I'll keep you posted. That's all for today. Take care, everybody.